Hey, welcome back to Upper Michigan Today. We're here with Dr. Anja Hoffstrom from Levita Sleep, and you have a couple of devices or objects that you brought with you today. Can you tell me a little bit about them?
Absolutely. So for those that have a positive diagnosis of sleep apnea, our main goal across the board is to get them treated because, as we can chat about in the future, there are a number of health concerns that one may deal with or have to deal with if they do not treat the sleep apnea. But everybody is pretty familiar with a CPAP machine as a treatment option for sleep apnea. It is the gold standard of treatment. It can work really well, but it can be really difficult to utilize. This right here is just simply the mask, a type of mask that can be utilized with a CPAP machine. Now keep in mind there's a hose that gets attached to this, that's attached to a machine. Oftentimes there is a tank, there is a humidifier, so there is quite a setup for a CPAP machine. Now again, this can work, but with the mask and the hose and the noise of the CPAP and the machine, it can be a lot. And if you think about having to travel with that, that can be quite a bit to pack up to take on the plane with you. But we have alternative options. There are surgical options that can be utilized to attempt to treat and manage sleep apnea as well. But we also have oral devices that I can make as a licensed dentist. Ooh. So I brought one of those here today. The oral device fits in your mouth. It fits on the top and the bottom teeth. And what it does is pretty simple. It brings your lower jaw forward. And by means of bringing that lower jaw forward, it is holding your lower jaw forward. It's holding your tongue forward. And it is physically holding your airway open.
Okay. It just looks like a normal bite guard, mouth guard.
Right. What's the difference between a normal mouth guard that you can get and mold to your teeth, maybe stop that grinding or unhealthy sleep habits, and this?
So a mouth guard is typically only going to fit on one of the arches, either the top or the bottom, and it is essentially going to provide protection to your teeth from those clenching and grinding habits. Now with the oral device that we can utilize for sleep apnea treatment, it fits on the top and the bottom teeth, and as I mentioned before, it is bringing your lower jaw forward and it's holding your jaw in a different position. A regular mouth guard is not going to be doing that. So this device brings your lower jaw forward, and like I said before, it holds your airway open by doing so.
So then those soft tissues won't collapse or fall back towards the back of the throat. Is that what I'm understanding?
Absolutely. So with the jaw coming forward and holding that tongue forward, it is providing more stability to the soft tissues of your upper airway, which allows it to remain open when you're sleeping and promote better breathing.
Is anybody with sleep apnea eligible for one of these devices?
So we typically in our office, we can make a device for almost every individual. Now there are some cases where it would not be possible, but I do a oral examination on every patient that I see to determine if they are a candidate for that device. Now I will say for the severe cases of sleep apnea, I always recommend the patient to utilize a CPAP machine because that is going to be their best form of treatment. But for those that are not able to use a CPAP or they have attempted and failed a CPAP, we can also put those individuals into the device. And based on research and different organizations, for instance, the American Academy of Sleep Medicine, the oral device can be the first line of treatment for mild and moderate cases of sleep apnea.
Wow. Do you feel immediate relief if you use it for the first night, or is it something that your body kind of gets used to using?
So there is a process that we work through with the device to find the ideal position for each individual. But on the very first night that you utilize your device, you are going to be in a treatment position, so you typically will have some result even on that very first night. And we oftentimes have patients come back after the first couple nights, or we reach out to them and they say that already their snoring has started to decrease, they're already noticing that they sleep better, and they're already noticing that they are sleeping longer and feeling better the next day.
Is this becoming a more popular therapy for sleep apnea?
Absolutely. I think that while we know that CPAP is still that gold standard of treatment and CPAP is very common, many of the providers in the medical community are becoming more aware of the device as a treatment option. I think not only because it is becoming more widespread that CPAP can be a little bit difficult, but also that sleep apnea is a severe chronic condition that is affecting so many individuals. We are trying to find options for our patients and trying to find options to comfortably get them treated. So along with treating patients in our office, I really strive to educate, spread awareness to both the general public and our medical community across the UP to work with providers and let them know that we have options for helping their patients.
I mean, I feel like your quality of life is directly correlated with your quality of sleep. So we do have one more segment left here on Upper Michigan Today, but we do have to take another quick break. And when we come back, we'll talk about maybe getting into Levita Sleep, conducting some of those sleep tests, and seeing a medical professional about your sleep problems. But we'll be right back. Stick around.